My name is Sterling Sheffield. I am both an audiologist and faculty at the University of Florida doing research in hearing aids and hearing healthcare and hearing loss. And thank you so much for being here today. I'm excited to talk to you today about hearing healthcare and options that are available to you, and hope that it will be helpful for you today. And I want to leave plenty of time for questions at the end. Just some disclosures, or to give a little bit of background. I am an audiologist, but I'm not currently practicing. I have a great relationship with the audiologists at UF Health Oaks. We work closely with them. And I do have that experience as a clinical audiologist, but do not currently sell or fit any devices that we're going to talk about today. Not here to market or recommend any particular devices or try and sell them to you. I have done research on hearing aids, as well as over-the-counter hearing aids and other over-the-counter amplification devices that we'll talk about today. And I don't have hearing loss personally, so I can't speak from a personal standpoint of that experience and struggles with hearing healthcare or hearing aids, but again, can speak from a clinical experience as an audiologist. So today I want to start by giving a little background about hearing loss, its impact on overall healthcare, the prevalence of hearing loss, and factors that we see that relate to hearing loss and its impact on individual lives. And that's going to lead into maybe what you've heard of recently, the Over-the-Counter Hearing Aid Act, and that over-the-counter hearing aids were approved and are approved for sale just last month, or now it's December, so October, about 6 weeks ago. And I'll talk a little bit about that, what over-the-counter hearing aids are and what that act says. And then I'm going to go through some considerations or recommendations I would like you all to consider before you pursue hearing healthcare and when you're deciding to purchase hearing aids or any hearing device. So hearing loss is fairly common. There's approximately 48 million Americans who have some hearing loss. But this has been an issue in our field and hasn't really changed since the 80s. Which is one of the reasons for the Over-the-Counter Hearing Aid Act, that only about 20% of those with hearing loss who would benefit or could benefit from a hearing aid obtain one. And for various reasons, I'll cover some of those in just a minute. That incidence or prevalence of hearing loss increases in older age. So 50% of Americans over the age of 75 have a disabling hearing loss, but even still, only about 33% of those individuals ever use hearing aids. There are two most common causes of hearing loss, and these are the two causes of hearing loss that are targeted through the Over-the-Counter Hearing Aid Act, and so I wanted to make sure to cover those. They are age-related hearing loss, which is called presbycusis, or the medical term, and noise-induced hearing loss. Both of those types of hearing loss cause a similar shape or configuration of hearing loss. On the audiogram, if you've ever had your hearing tested, then you might have seen this. So this audiogram has pitches from low to high. It's like left to right on a piano, if you're familiar with a piano, as we go up in pitch, and then sounds from soft to loud. And what's shown here are the softest sounds that an individual could hear or responded to. And the left ear is shown in blue X's and the right ear in red circles. And this is a common, again, age-related or noise-induced hearing loss, where in the lower pitches, you have relatively good hearing. 20 or 25 and above is considered within normal hearing limits. So most people are very near or within normal hearing limits in this group in the low pitches, but their hearing gets worse in the high pitches. And so they don't hear high-pitched sounds as well. Unfortunately, high-pitched sounds tend to be the consonants in language or speech, and the consonants are most important for speech understanding. And so it ends up having a big impact on speech understanding when you miss these high pitches. There are many other causes of hearing loss, which I'm not going to go into all the causes of hearing loss today. But most of those other causes of hearing loss are not the target of over-the-counter hearing aids. And we often want to recommend for any other type of or cause of hearing loss that you definitely see a hearing healthcare professional to determine the degree of your hearing loss and how best to treat it. All right, so as a hearing healthcare profession, we separate the population, the general population, into these different groups based on whether you have hearing loss, documented hearing loss on an audiogram or a hearing test, and whether you have hearing difficulty or you notice and struggle hearing in your daily life. It keeps you from being able to do the activities you'd like to do, to be able to communicate with the people that you'd like to communicate with. So we have this group with normal hearing and no hearing loss. Those people we don't see, they don't need hearing health care typically. We also have people over here who have documented hearing loss, but no recognition of hearing difficulty within their daily life. So they come into us as audiologists, we measure their hearing, we find that they do have some hearing loss, but they say, hey, I'm doing great, I don't need anything, and don't end up getting any hearing aids or any hearing help. We also have people, and some of you might fit into this group, who have no documented hearing loss, but still struggle hearing in your daily life. And we see these common in the clinic as well, where someone comes in, they say they're struggling to hear at work or in social situations, particularly when it's noisy. We test their hearing and it all comes up relatively normal. But they say they're really struggling and want something. This is if you are an individual like that, an over-the-counter hearing aid, or we'll talk about some other types of the devices that might be available for you to try that will hopefully help you. These are our individuals with hearing loss as well as hearing difficulty who own hearing aids. These are the people that come into audiologists, they buy hearing aids, they use their hearing aids regularly and hopefully are helped in their daily life with the hearing aids. And then we also have people who have documented hearing loss. And again, some of you might be these individuals, documented hearing loss, struggle hearing in their daily life, hearing difficulty, but for whatever reason, don't own hearing aids. Maybe it's cost, maybe it's other barriers, which I'll cover in a second. And hopefully the Over-the-Counter Hearing Aid Act or other things will help to relieve those issues. So before we get to the barriers to hearing aids or to purchasing hearing aids, I want to touch on the broader impacts of hearing loss. So hearing loss, and most of this is more recent research within the past 10 years or so. Hearing loss used to be considered somewhat in a silo of just, you can't hear very well, do you need hearing aids to help you hear better? And we'll treat that. But in the past 10 years or so, there's been some very strong research showing that hearing loss has several health risks, including communication challenges, which we know, but also social isolation, mental health challenges, accelerated cognitive decline, that have an impact on your greater life and quality of life, as well as overall health care. And one study that was published in 2019, looking at the connection between hearing loss and comorbidities in adults over 50, found that patients with untreated hearing loss experienced about 50% more hospital stays, 44% higher risk of hospital readmission, 17% more likely to have an emergency department visit, And about 52 more outpatient visits compared to those without hearing loss. And the greatest relative increase in risk was estimated for depression and dementia, with hearing loss being associated with approximately a 50% increase in both conditions over 5 years. So at this point, we do not know, and I want to make this clear, we do not know that hearing loss causes dementia. We don't know, or accelerated dementia. No one can say that. That isn't known, but we know they're associated, and that hearing loss isn't this silo that we used to consider it. It is impacting greater health, overall health. And so there's a larger focus overall in making sure that people are aware of that and offering hearing health care for anyone that's experiencing hearing loss. Yeah, what are some adoption barriers to hearing aids? If you've ever considered hearing aids and not worn them, some of these might resonate with you. We know if you look at the literature, and there's, I showed just three studies here, but there are a number of studies looking at this and show that there's still a strong stigma towards hearing aid use within the general population. Many people don't perceive their hearing as having a big impact on their life. And that's one reason we're also, that this research has started focusing on more global impacts to health related to hearing loss, and not just struggling communicating with in your daily environments. One barrier that comes up is the difficult process in obtaining a hearing aid, that you have to see a hearing healthcare professional, audiologist, or hearing instrument specialist, that then you have to order the hearing aids, go back in for a fitting, et cetera. And it can be a bit of a process. And that's partly why the Over the Hearing Aid Act came to be. Cost is always one option that comes up consistently. It's never been found, both within the US and globally, to be the only barrier to people getting hearing aids. But we know that cost can be a barrier, and consistently comes up as one of the top reasons. Again, one reason why the Over-the-Counter Hearing Aid Act has come to be. I also want to mention that we know that there are health disparities in adoption of hearing aids. We see that adoption rates vary significantly by race and ethnicity, as well as income level. Part of that's driven by cost, but there are other factors as well. We've been doing some research in my department in college, looking at predictors of hearing impairment, receiving a hearing evaluation, and hearing aid use. And I want to point out there are some differences here when you look across racial and ethnic groups, Hispanics, whites, blacks, and others, which include Asian, Pacific Islander. This is sort of an amorphous group that's hard to define at this point, which we're working more on. But you can see that age is a common factor in most groups, but not in our African American group. And sex has a different impact on Hispanics and whites as far as hearing aid use than it does in this other category. So we see differences in hearing aid adoption and reasons or barriers to getting hearing aids, and factors that influence people getting hearing aids across different racial and ethnic groups. So for all of those reasons, to hopefully combat the health disparities that we see in hearing healthcare, to hopefully increase access and ease of getting hearing aids, so that more people will get hearing aids, we can increase that 20 to 33% of people who could benefit from hearing aids buying hearing aids. In 2017, Congress signed an act for over-the-counter hearing aids. And it was part of the Reauthorization Act. And the goals were to increase access to amplification devices or hearing aids with lower cost options, to increase access to amplification by removing the need to see a hearing healthcare professional for testing and hearing aid fitting, and a general hope that we would improve the hearing healthcare disparities. I'm going to address later the benefits of seeing a hearing healthcare professional, whether you're pursuing over-the-counter hearing aids or not. But these were the goals of the Over-the-Counter Hearing Aid Act. Now, this is the timeline. So in 2015 was the President's Council of Advisors on Science and Technology recommended this. In 2017, as I said, Congress signed law into effect, but regulations had to be created for over-the-counter hearing aids and then approved. And this ended up taking quite a long time. There was a process of getting input from the hearing healthcare organizations. The pandemic ended up delaying some of this occurring. And really in the past year and a half, the timeline accelerated. And the proposed regulations were put out last year in October of 2021. And then in August of 2022, they announced the regulations and that over-the-counter hearing aids would be approved for sale starting October 17th, 2022. So just about 6 weeks ago, they were approved for sale, and we see some on the market already. And we expect to see the number of devices available on the market to increase quickly over time. There aren't that many that are fully approved at this point as over-the-counter hearing aids, but we expect that to increase. So what are these over-the-counter hearing aids and who are they for? They are intended for age 18 and older adults. So over-the-counter hearing aids should never be used for children. They are to compensate for perceived mild to moderate hearing impairment. And so if you have any worse hearing impairment than that, and I'll go over this a couple of times, then these devices will not work well for you. They can't amplify enough to give you enough benefit. They also, the regulations specify that they should allow consumers to readily achieve a safe, comfortable, acoustically favorable, and physical fit. So they should be comfortable, should be able to fit any ear, and should allow consumers to do it without a lot of assistance. They must have a user-controlled volume control. So I'll cover a little later the variability in these devices and how much control or flexibility they have. Some of them have only a volume control, and others are very flexible with a lot of options as far as how you can set them. And so we see a large variety. And they must be self-fitting, meaning that it allows you as a consumer, someone who buys these devices, to set them all on your own, to make any changes that you want to the device. They don't have to be hooked up to any specialized software or have you see a professional to have these fit. And the devices must be available over the counter without the supervision, prescription, or involvement or intervention of a licensed person. This includes transactions in person in stores. It includes mail, online, a number of different venues, which I'll touch on a little bit more in a second. So any of you who have already used hearing aids or who are familiar with hearing aids, now that we have over-the-counter hearing aids, we have what are called prescription hearing aids, which that term didn't exist before. But now prescription hearing aids are any hearing aid that is not an over-the-counter hearing aid. And so any other hearing aid is a prescription hearing aid. And if over-the-counter hearing aids are not appropriate for you or won't work for you, prescription hearing aids should work for virtually anyone with a hearing loss, unless their hearing loss is severe enough, severe to profound, to where they would need a cochlear implant or something more invasive. But in general, hearing aids, prescription hearing aids will work for anyone with hearing loss. So let's talk a little bit more about these devices. So I just mentioned what over-the-counter hearing aids are. It's a new designation of hearing aids only for mild to moderate hearing loss or perceived mild to moderate hearing loss. And these are predicted to cost between $500 and $1,500 a pair. So these aren't going to be very cheap devices. And there are already some over-the-counter hearing aids that are on the market for more than that, up to $2,500 to $3,000. Compare that to prescription hearing aids. You may have heard, and what's often quoted both in the news media as well as in the literature, is the average cost of hearing aids, prescription hearing aids, is about $5,000. That tends to lean towards the higher end of hearing aids. Prescription hearing aids can be low, middle, or high end as far as the level of technology and the flexibility and within them. And so there's a wider range as far as hearing aid, prescription hearing aid cost, anywhere from about $2,000 up to about $7,000. And that again depends on the technology as well as the location or clinic that you're purchasing the hearing aids from. There are two other devices that I want to make you aware of, device types, because you might come across these if you're searching for purchasing something to help you hear. PSAPs are personal sound amplification devices. These are devices that have been available online or over the counter for decades in various forms. These are marketed not to treat hearing loss. They're considered consumer electronics by the FDA, and they're marketed to help you hear in noisy environments. They amplify sound and have varying degrees of flexibility. They tend to be cheaper than over-the-counter hearing aids will be and are. But it will be critical to not confuse a PSAP with an over-the-counter hearing aid when you're looking online, because they'll all be designed to amplify sound or to help you hear better. And so making sure you know what type of device it is a good thing to do before you purchase something. There are also even cheaper devices, which are called hearables. And these are situation-specific devices. So as a clinical audiologist, our general recommendation is if you struggle in a lot of environments in your daily life or most environments and need to hear better, a hearing aid is a good option for you. In contrast, if you only struggle when you go to the movie theater, and that's the only time you ever need to hear better, a hearing aid is not the best option for you. You should do something in the theater to hear better. And the theater offers assistive listening devices or to help you hear better there. Same thing here. If you only struggle listening to your own TV in your home, there are devices to help you hear your TV better. That's all it's designed for. You can buy that just for the TV, the phone or something like that. That's what hearables are for just one specific situation to help you hear. To where hearing aids or all three other devices are more general. So where can you purchase these devices? Over-the-counter hearing aids, PSAPs, as well as hearables. All of these are available over the counter, meaning that they can be purchased online. If you're searching online, you can find a number of these different devices. They can be purchased at a pharmacy or electronic stores. They're available at Walgreens, Walmart, Best Buy in different forms. And you can also purchase these from some audiology hearing clinics. And this varies on the clinic. So if you're curious, you need to contact that clinic. UF Health Oaks does not sell these devices right now. Partly in talking to the audiologist there because they're new and they want to wait until they know what's a quality device that we feel is worth recommending and potentially selling to our patients. So because these are all brand new since they were approved just 6 weeks ago. I want to mention, just because we're going to come back to the need for support, but want to mention here that you can receive some support in fitting these, depending on, if some audiologists and hearing instrument specialists will provide support if you're needing support, as well as some manufacturers or possibly the distribution company like Best Buy will offer some support. We're going to come back to recommendations, but one recommendation I would have before you purchase a device like this is to know what support is available, because you might need it. These devices are not as simple as reading glasses or glasses where you put them on and there's nothing else to do. And what we found in research, and I'll come back to this, is most people need some level of support to help get them fit on their ears correctly, to help know how to maintain them, etc. Prescription hearing aids, you can purchase them and receive support only through professionals. So here, audiologists or hearing instrument specialists. Audiologists are individuals who get a clinical doctorate, trained for 4 years in all things hearing and balance related to the ear, including hearing aids. It's one small part of what we do. To where hearing instrument specialists, depending on the state, get less than a year's worth of training, but only in hearing aids. And that's all they do is fit and sell hearing aids. And just so you understand, and you might see either one of those individuals at various clinics, including Costco, Sam Clubs, or private practice clinics. These will be fit to your individual hearing loss, as opposed to over-the-counter hearing aids are often fit based on sound quality and what you think sounds best to you. And they're programmed to match amplification, known to provide best possible benefit. And this is from decades of research within the hearing healthcare field, looking at how can we best program hearing aids to give people the best speech perception and hearing possible. And so those are often done, that's often done with prescription hearing aids and is not with over-the-counter hearing aids. And then you also, through those audiologists or hearing instrument specialists, can get counseling, maintenance strategies, as well as support, any support that you need. All right, so let's get now to the considerations. I have 3 considerations you should make before you purchase or any hearing aids or amplification devices. The first is insurance coverage. Many insurance coverage plans cover a hearing evaluation, and you should find out whether yours covers a hearing evaluation before you pursue any hearing health care. It may or may not. Some insurance plans provide at least partial coverage for hearing aids. Again, find out if you have any coverage for hearing aids and whether that would apply for over-the-counter hearing aids or just prescription hearing aids, or one or the other. But there's usually minimal coverage from insurance for other visits to the audiologist or a hearing professional, if you haven't experienced that. That's something that we as a field really are advocating for and trying to work on, because we feel that it should be covered and we want you to be able to have better access to hearing health care. But I want you to be aware that most visits are not covered, but the initial evaluation often is through insurance and sometimes hearing aids. The second is the impact of hearing loss on your personal life and health. And I really should have put this first when I was looking back. But I mentioned earlier the impact that hearing loss can have on, based on research on overall health. But you as an individual, before you pursue any hearing health care, should determine what impact is it having on your life. And make sure to consider this from more of a global standpoint than I can't hear my lunches on Tuesday. Think about, does it stop you from doing activities that you would normally do? That's often something that we see with social isolation, overall health struggles. We'll see people stop going, stop going to movies, stop going dancing, stop whatever, because they struggle hearing in those environments. That's not something that we want to see, and you want to take that into account. You can obviously gain some insight from discussing this with your social circle, family, and friends of where they see it impacting your life or their lives, that may help you understand the impact that hearing loss is having. I'm skip to this third one here. The third one is, do you need to see a professional before getting hearing aids? So over-the-counter hearing aids opened up the option to not see a professional and buy a device directly. As a professional, I want to make clear that ideally, I feel like it's that everyone should see a professional for a full hearing evaluation before purchasing any amplification, even OTC hearing aids. And I bring that up for three reasons, at least. So one is to determine if you're an appropriate candidate for the device. We know that these devices, over-the-counter hearing aids, don't amplify enough for hearing loss worse than mild to moderate. And you might not feel like your hearing loss is that bad, but it might be worse than that mild to moderate, and then that device is not going to help you. So if you get a hearing evaluation, an audiologist can easily tell you, oh yeah, you have a mild to moderate hearing loss, an over-the-counter hearing aid should probably be able to amplify enough for you. The second reason is to ensure that you don't have any medical contraindications. They're, as I mentioned, over-the-counter hearing aids are designed for people with age-related or noise-induced hearing loss. If you have any other type of hearing loss or cause of hearing loss, it probably won't be fit or might not be fit well with an over-the-counter hearing aid. And I'll bring up some examples of this in the next slide. And then the third one is you can have a hearing aid fit to your individual hearing loss if you get a hearing test. And there are actually some over-the-counter hearing aid companies that also offer you to send in an audiogram, and they'll fit it to your audiogram or your hearing test. And so it can give that advantage as well. So we know that it's difficult for everyone to receive a hearing evaluation, particularly when you consider socioeconomic status, rural areas, et cetera. So it's critical that some individuals with risk factors or contraindications get an evaluation, and they're listed here. So again, these are not for children, so anyone younger than 18. If you have a big difference in hearing between your ears, if you know my right ear is a lot better than my left, that's a reason to see a medical professional, get a hearing evaluation, and not just go for over-the-counter hearing aids to see what's causing that difference between the ears. If you've had a sudden change in hearing in the past 6 months, that's a reason to see a medical professional. You might have something more going on that you need to have checked than just can be fit with over-the-counter hearing aids. If you have any ringing, roaring, or beeping in one or both of your ears, if you have taken any medication that causes hearing loss, if you have a history of chemotherapy or radiation, particularly in the head and neck region, in the last 6 months, if you've had any drainage from your ears, and then if you have constant or pain or discomfort in one or both ears. And the last one is if you experience dizziness. Dizziness can be related to inner ear issues, and a reason to see an ear, nose, and throat physician and an audiologist. Okay, so that covers my 3 recommendations before you pursue any amplification. Now I want to cover considerations for purchase of hearing aids or amplification devices. The first one is the return policy and warranty. So with these over-the-counter devices, becoming available, you can purchase them directly online or in the store, and you should know what the return policy is and warranty. Some of these devices come with great return policies and warranties, similar to prescription hearing aids, 3 years. Some don't. Prescription hearing aids come with 3-year warranties typically. And all right. The second is cost. So we know that, as I pointed out, the different cost of these devices, prescription hearing aids can have a wide range. You might find that a low-end prescription hearing aid can give you just as much benefit, plus you'll get the support of a hearing professional. And high cost doesn't always mean a better hearing aid, particularly when it comes to over-the-counter hearing aids. We've been doing some testing with these, and higher cost isn't at this point at least correlated with a better device. So you want to make sure and do your homework on the quality of the device. These are some of the devices that we've tested. You can see some different styles. Most of these have a behind the ear portion. This one is an all in the ear portion. You can see a range of cost here. And you can see a range of the options that come with these devices, such as a volume control, whether they're rechargeable or not, or require you to replace by replaceable batteries. Some of them are controlled by apps versus some of them just have buttons or are controlled right on the device. So knowing how they're controlled and what options are available can also be critical before you purchase a device. Making sure that if they are controlled by an app, it's available on your smartphone or a device that you own. Yeah, so making sure you look into what features or controls are available, technology is available that you understand and are able to use it before you buy a device. Virtually all prescription hearing aids have all the best features found in OTC hearing aids and sometimes more. The biggest difference in prescription hearing aids are that they're not self-fitting. So it means that you have to visit a hearing professional and have them program the devices for you. And any hearing aid controls that you're given, such as a volume control or whatever, can be set by the hearing professional in consultation at the fitting appointment. All right, so we, as I mentioned, have been testing hearing aids and over-the-counter hearing aids and have found that these devices vary widely, both in their electrical performance, their ability to amplify as best as possible for different hearing losses, for their speech understanding and noise, for their sound quality. Prescription hearing aids are much more consistent in this area, at least at this point. OTC hearing aids are very new, but they are variable. So if you're purchasing an OTC hearing aid, I'd encourage you to make sure that you get a good one. Now, how do you do that? So they were just approved last night. There aren't really a lot of many registered devices through the FDA being sold yet. And we don't really know which ones are best yet. So look for the official OTC hearing aids registered with the FDA, not just PSAPs or other devices. And then options to make your best guess, which these are just my thoughts, is you might consider trusting established hearing aid companies. We know that some of the hearing aid companies that we've worked with as audiologists for decades are going and are producing these over-the-counter hearing aids. These might not be names you're familiar with because they're not super familiar to the general public, but they're companies that know how to make hearing aids because they've been doing it for a long time. You might trust quality companies. You might trust customer reviews like we do with a lot of devices or things that we buy. Or you might trust the recommendation of a hearing professional. And so if you have a hearing professional, if you see a hearing professional, you can talk to them and ask what they would recommend and how you choose a device. All right, so I mentioned that a lot of people want some support with hearing technology. This is a study from 2019 that looked at how adults with who were candidates for over-the-counter hearing aids, how successful they were in fitting and using their own over-the-counter hearing aid. They found that only 25% of the subjects or people in this study were successful without any assistance. 43% more were successful if they received assistance from a trained clinical assistant, so from someone. And again, I mentioned this might come from the manufacturer, it might come from the company you're purchasing it from, or it might come from a hearing healthcare professional. But if you feel like you might want some support, or need some support, I'd encourage you to think about where am I going to get that if I struggle with an over-the-counter hearing aid. So the good news is that that's close to 75% of people with at least some support did well with these over-the-counter hearing aids. There were about 32% that never achieved success fitting a hearing aid on their own, or even with some assistance from a clinical assistant. Some factors that predicted success were cognitive ability, locus of control, problem-solving skills, and self-efficacy. A couple of other things related to that. A lot of current OTC or over-the-counter device owners in this recent study were asked how much, if at all, do you feel you would have benefited from having a healthcare professional help along the way? And about 70%, 75% reported moderately or a great deal. So they would help or like to get some support. And a lot of people feel that they do get some support from audiologists when they're using hearing aids, as shown here, a great deal or moderate support. So as an audiologist, I want to partly, as I'm here today, advocate for the field that we aren't just there to sell you a device and give you the device and send you on your way. We are hearing healthcare professionals that can give you that support, that counseling, that service to help you with any type of hearing device, as well as any other support you need with your hearing healthcare. Now, what if I do buy an OTC device and it's not helping me enough? So if you notice that you bought one, you're still having difficulty understanding in conversations, I'd recommend you go see a hearing health care professional, audiologist, or something similar. If you're experiencing any imbalance or dizziness, any pain or discomfort when using the device, any ringing when using the device, anything like that, definitely see hearing healthcare professional to get support and find out what's going on there. So in summary, hearing loss impacts overall health and quality of life. Most people who could benefit from hearing aids don't get them, unfortunately. And so over-the-counter hearing aids were just approved this year, and maybe that will help to improve access for people and cause more people to seek out hearing healthcare. Prescription hearing aids are still available from a professional. And before you purchase hearing aids, I recommend checking your insurance, seeing a hearing healthcare professional like at UF Health to see what you're a candidate for. And especially if you have any ear symptoms or red flags that we talked about, to see a hearing healthcare professional. And then when you're purchasing, consider warranty, cost, device quality, features and controls, as well as any available support and where you'll get that. And want to acknowledge everyone that's helped me in this research and work, and take questions now.
We have some questions up here.
What is the correct pronunciation of the word? Whatever.
Yeah.
Related to that, what's the current status of research and treatment?
Great question. All three great questions. So tinnitus and tinnitus are both appropriate. Tinnitus is a little more common, I would say, rather than tinnitus, but it depends on the area of the country. So I did my clinical training at the University of Iowa, and tinnitus was more common there versus down here, I don't hear tinnitus very much at all, and Maryland as well. And so it, yeah, varies in the country. Now, as far as treatment, so it really depends partly on how much tinnitus is impacting you in your life. And so there are management strategies, which are usually the first step. So for example, if your tinnitus, if the main issue is you are struggling sleeping because of tinnitus, then we can work on management strategies to help you sleep. Hearing aids help. But then I'll mention there are also experts in audiology and tinnitus, which I am not one, for full disclosure. And that's what I would recommend if you're beyond that point, beyond management strategies. Now, do hearing aids help? Typically, yes, especially if you have a hearing loss. Wearing hearing aids will reduce tinnitus or reduce the handicap for tinnitus or impact that tinnitus is having on your life. So, yes.
Okay, we have another question here. Can you speak to whether Medicare covers and how long?
Good question. So I do not, I also don't claim to be an expert in insurance coverage. And so I would contact, it depends on what also parts of Medicare that you have, the extra supplemental plans. But Medicare typically covers the hearing evaluation. Beyond that, it depends on the supplemental plans you have, et cetera, on whether there's any more coverage than that.
Do you have any locally recommended professionals that do deal with tinnitus?
Oh, I'm seeing a shaking from the head from my friend and colleague Katie Gray back there, who's the director of the UF Health Oaks Clinic. I don't here locally. Yeah, not here within the Gainesville area for sure. So I'm sorry that let me give, if you could see me after I get my card and get your contact information, I want to check and see if Jacksonville or like something a little distant, but not here in the Gainesville area.
Does the introduction of white noise, in your opinion, have any impact on the irritability of the tinnitus, ringing that I have experienced every second of every day?
I'm sorry that you're experiencing that. So that depends on the individual. I've definitely seen it and know that it does for some individuals help. But for others, it doesn't. And for some, it depends on the noise or the sound that you use. So white noise might work for some people, but you might be helped by a different type of noise or sound more than white noise. So trying different sounds to find what works the best. Most prescription hearing aids, I should say, some prescription hearing aids have tinnitus maskers built into them. And then you can try different types of tinnitus maskers if you need it all day, to where if it's again, a sleeping thing, then you can get, noise maskers and try different noises and different sounds. But yeah, if it's an all day thing, a lot of prescription hearing aids have tinnitus maskers built in that you can try different sounds.
Could you comment on this? For example, TV sound.
Yes, great question. So when it comes to the TV, these are typically additional assistive listening devices, and they can work with hearing aids or without them. So for example, for my father-in-law, we bought him a pair of just headphones that are Bluetooth from the TV. And he can listen to the TV at his own volume, and then his wife, my mother-in-law, can listen at her volume, and both be comfortable. To where if you wear hearing aids, the company that produces the hearing aids often offers an assistive listening device that you would buy in addition to that and plug into your TV, and then that would pair to your hearing aids. Is my most common experience. Does that help? Uh-huh.
You buy the device for your professional office, or do you buy that?
So if it's from the hearing aid manufacturer, I'd recommend to go through your audiologist or your clinic, at least to ask, do I get it from you, or where can I get it? Yeah, if you're buying like headphones, like I talked about, you can just buy those online.
So what do you have to say about how to evaluate 3 tests within a month by 3 different audiologists, 2 MDs, and 1 audiologist, with varying responses, and 1 recommending hearing aids, and 2 saying, you don't need them?
Great question. And this gets, and that's a complicated question. Obviously, I can't speak to all the, all the possible reasons. There are certain causes of hearing loss that can fluctuate. And so, it's possible that you have a cause that's of hearing loss that actually is a fluctuating hearing loss, which may cause some differences. I'd have to see how big the differences are to speak anymore. But as far as your recommending hearing aids or not, you'll get different opinions from different audiologists. I tend to not base my recommendation for hearing aids on the audiogram or your hearing test as much as recommending them based on your personal experience of the struggle that you're having. If you struggle in your daily life hearing, and it's impacting your activities, what you're doing, how you're able to communicate, then I would recommend something to treat that hearing loss. And whether it's hearing aids or the counter hearing aids, there's something, you need something to where not as much based on the actual hearing test for me. Mm-hmm.
I work with young performing artists. I was just wondering if, there's any sort of assistance or devices available for people to bring to performance venues that would help them. And if there are any perhaps best practices for us to give to our patrons who come to see events.
Very nice. So you're talking about patients with hearing loss. So yes, there are devices. If it's someone with hearing aids, then the best setup, and I should be more aware. I apologize. I'm not super aware with the buildings at UF and how available loop technology is. But induction loop technology for telecoils. People who wear hearing aids and have a telecoil, that's a great option to have it go through a telecoil loop system. You can also set those up with headphones. And so if someone doesn't have hearing aids and struggles and needs to hear better, then you can set them up with headphone systems.
Question here. Lost during 1 year, there's finding the other, it's journey out there, and there's always like it's a surgical process.
Yeah, great question. How long ago did it happen?
I was kind of gradual process. We had hearing successfully, but I had some positive hearing aid. I had that been using fine control, each side of the vision and all that. But then my last visit to the my test said, "Oop, it's gone." So
Gone in 1 year. Okay. Yeah, it's tough to only hear in one ear. We know that if you look at all the literature, it shows that people prefer to listen with both ears, even if one of them's not as good as the other. You prefer to listen with both ears. Generally, it just gives you that stereo sound. There are a few options, and they have varying kind of purposes or benefits that they bring with them. One option is a hearing aid device that it wouldn't be invasive. It's a hearing aid device that sends sound from one ear to the other. It's called a cross or a bicross. And some people like those and some people don't, because it doesn't give you that stereo sound. It's just sending sound from one side of the head to the other. And so it'd just be something that you'd have to try. Again, prescription hearing aids and crosses would be included, have trial times or return policies, a trial period where you can try it out.
Things were pretty good. Just say, hey, here's the video.
Yeah, exactly. Yeah, turning the ear. Yeah, if you can do that. So the other options are a little more invasive. So they require either a minor surgery to put in an abutment on your head that allows a vibration device that sends sound to the other ear, or as far as in our experience with people, especially with short-term single-sided deafness or hearing loss in just one ear, a cochlear implant is the one that they like the best. But obviously, that's a bigger decision and something that could be discussed with your audiologist there at U of Health. I know them well and know that they've done some single-sided deafness cochlear implants for those individuals.
Okay, got our next question right here.
Hi there. My hearing loss is caused by inherited condition. Apparently, my bones are calcified, and I haven't been able to hear a lot of what was been going on. So maybe you touched on this. But I have had a stapedectomy back in the 90s, and I've been told since then that I cannot have an MRI because of the materials in my stapedectomy. I still need to find out what it is. But I also read somewhere not to use electronic devices like earbuds and things like that, because everything's digitized, magnetized. If you have something magnetic in your body, you could do some damage with these hearing aids. And so I'm wondering if there's any progress on that, or if I missed something here in this discussion about if you have some magnetic devices that can be affected if you get one of these hearing aids. And so it wouldn't be good for the person.
Ooh.
That's not a very coherent question, but anyway.
No, I think it makes sense. But that's a tough, without knowing, what the actual material is and the condition. I don't want to give any specific recommendation or can't say anything specific about what would be included. I'd encourage you to just see an audiologist.
An audiologist be the person, or would it have to be a surgeon or somebody that?
So it would likely be a joint appointment with the audiologist and the ENT, just to understand the surgery and what was put in, and then together you would get a good picture of what options you have.